Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thank you for joining us again today. We have another great show in store for you. We're going to talk to you about home care, and today's guest is Gary Kinnlair. He is the president, co-founder, and chief franchise developer for CareMinders Home Care. Gary, welcome to the show today. Thank you for joining me.
It's a pleasure to be with you, Jeannie. Thank you.
Well, let's start by just talking about what is CareMinders Home Care?
CareMinders Home Care is an organization that was developed to award franchises around the country, including here in the Atlanta area, to provide non-medical and skilled home care for folks in their homes.
What do you mean by non-medical and skilled? Let's start with non-medical. What are the types of services that CareMinders provides in the home? Under
non-medical, you can divide up non-medical into two components. One is called companion care. And companion care is where the caregiver is the companion for the person. They could be helping them with their errands and keeping their house tidy and maybe make some meals, being with them so they're not alone. But also under the non-medical side of home care, we have what we call personal care. And we call that the activities of daily living, the ADLs. And that's when the caregiver is really physically beginning to touch the client, physically giving them a bath, a shower, brush their teeth, helping with grooming and dressing, and so forth. And so on the non-medical side, those activities are for folks that are not just over 65, but it can be for folks from the day they're born, to folks that are over 65.
And do you see that most folks, what is the percentage? Do most people just need the companion care, or is it an equal mix of folks that need help with their activities of daily living that seek out home care assistance, or is it more companion care?
It's actually, Jeannie, all over the place.
It is.
It really is. On any given day, you just don't know. In some cases, we love the phrase aging in place, because some people start with companion care. Then they segue into needing personal care services, and then they segue into skilled care. And that's where it's really neat to be able to have an agency that is able to allow someone to age in place and segue through those processes.
Okay, I'm a little bit confused because we talked about companion care, and I understand that's errands, cleaning, meals, just staying with somebody to make sure they're safe and they're taken care of.
Right.
Personal care would be the activities of daily living, helping bathe them or helping them get to the bathroom or eat, because they have to do a little bit more than just cook the meal. They have to assist them in eating that meal
Correct.
as well. So tell me the difference between the personal care and the skilled care. When does it then become skilled?
Skilled care is when you start needing the services of a nurse.
Oh, okay.
A registered nurse or a licensed practical nurse, an LPN. Now we're doing things such as wound care, cleansing of a Foley catheter, ventilator maintenance, things that you would see in an institution, services provided by RNs and LPNs.
I see. Okay. Now that's different, I think, for a lot of home care agencies. Do most home care agencies offer LPNs and RNs, or is that different for CareMinders?
It is. We're very unique. In fact, recently, we're very proud that we made the Entrepreneur Magazine Top 500 list, and they said to us, wow, we wish we could put you in your own category, but we must put you into this senior care category because you're really the only ones doing this and what we call the entire healthcare continuum of home care. So it is a unique service, and it really reduces the stress for the referral sources. The folks that are discharging a patient at a hospital or a doctor's office, on any given day, Jeannie, they don't know if somebody needs companion care, personal care, or skilled care, or a combination when they wake up in the morning. And so now they can call an agency and be able to have those services provided for those for their patients.
And really the future is to keep patients at home. And the government is recognizing just how much money is paid towards these rehospitalizations. So hospitals are going to be really looking at their discharge plans a lot more closely, and I assume increasing the use of home care and home health and hospice care in the future.
Absolutely. At CareMinders, we have a phrase, life at home is the key to independence. And I'll give you an example. 3 or 4 years ago, our former governor, Governor Sonny Perdue, mentioned in his one of the speeches, and he mandated we've got to get children out of nursing homes. A lot of people do not realize that across our country, 1 out of 6 individuals, or approximately 15% of everybody that's in a nursing home, is a child under the age of 18.
Seriously?
Yes. Can you imagine being a 14-year-old?
1 out of how many?
1 out of 6. Could you imagine being a 14-year-old boy or girl down the hall from somebody who is older and is having certain issues and so forth? We've got to get them out of the institutions. Same thing the Veterans Administration is saying. So the goal is to get people back in their home, near their family and friends, their pets and plants. They might have a favorite house of worship. We don't want to split up spouses. In the past, Jeannie, we would have spouses that would have, one of them would have an issue or an ailment, and they would have to go into an institution, and the other spouse was left behind.
I see that a lot.
Absolutely.
Yeah.
So now let's keep everybody together.
Okay, so that being said, you can help them, like you said, through the continuum of care. Mom or grandmom starts forgetting, let's just say, early stages of dementia. So in the beginning, maybe it's just companion care because she's still very independent. And then as she declines, you're going to move into that personal care and that assistance with the ADLs, such as bathing and going to the bathroom and eating. And then as she continues to decline, you've got the nurse and the LPN there monitoring her, making sure she doesn't fall and helping the family understand, am I right? Am I on the right path?
Absolutely. Aging in place. Now, I will say that sometimes, though, when somebody needs help, they might need that nurse to come in once, twice, 3 times a week. And at the same time, for some or all the rest of the time, they need that companion or personal caregiver to help them with the various chores and tasks that they would be providing.
I see. So that being said, let's talk about the cost. How do people manage this? Because home care, in what we're talking about right now, that's private pay?
Well, one thing that is great about our system for our franchisees is we try to put them into a recession-resilient environment where in the past people think home care is only paid for by the families. Well, sometimes that does happen. But let's also put them in an environment where other companies, agencies, institutions are paying for home care. On the non-medical side, many times it can be paid for by the family, the parents, the children, whoever it might be. They might have long-term care insurance programs, wonderful products called LTC plans, where it helps pay for benefits for home care. There's government agency programs, the insurance companies, the Aetnas, the Cignas, United Healthcares, the Blue Cross Blue Shields. Many people's medical plans may have home health care provisions in it. Not all of them, but some of them. Veterans Administration, they're working to take care of those that have served us.
Yeah, and I know a little bit about that. I want to talk a little bit more about that in just a sec. But I did want to kind of go back because, I've been in this industry for a while, Gary, and I've seen so many things. And one thing I don't know is how much it costs for folks every time they have a hospitalization. But based on 80% reimbursement or 65% reimbursement, depending on what insurance you have, every time your loved one goes to the hospital, you're going to get a huge bill that you have to pay.
Right.
And so people don't realize the preventative benefits of bringing home care in even before that hospitalization occurs, because it's going to even out and your loved one's going to be stronger and maybe not have that fall and that broken hip or have that exacerbation that makes them weaker, and then you're going to be able to live more independently at home. So I wanted to throw that out to the folks out there in the communities because I see that so often. It's really hard in this day and age to come up with extra money every month. It really is. And it's never, ever a good time. But it's better to plan and pull the family together, in my opinion, and think about how you can share that cost and keep mom and dad at home and safe. And I'm living in the age where I'm worried about taking care of my parents and my children at the same time. But going to the hospital and getting those exorbitant hospital bills when I'm not ready for it is scarier for me than planning care to keep mom safe.
You're absolutely correct, and I come from a previous life, in my past life when I was a certified financial planner, and planning was very important, whether it's for your estate, whether it's for your college education planning, whether it's for your health care needs and home care needs. And CareMinders, very important to both our franchisees as well as their clients. We want to put a wall of protection around our folks. We believe in risk mitigation. We want to prevent, Jeannie, stuff from happening before stuff happens. And so with a potential client, patient in the home, and when we talk to the family, we do assessments, professional assessments only done by registered nurses, where let's check out the issues related to falls. As you're stating, if we can prevent falls, fall prevention is huge. You know, my mother is 81 years of age and soon to be 82. Heart and all those issues are important, but it's the fall when she's walking the dog.
It's the fall. We've got to prevent the fall.
And the brittleness of the bones and all. So prevention of issues happening before they do. But like you say, planning, you know.
And not being afraid to pull home care in, even though you may have to pay for it, because in the end, it may even out anyway, is what I'm trying to get at.
And in many, many cases, it is more cost effective than going into an institution.
Yes.
Institutions, depending on what part of the country you're in and what services you need, can cost anywhere from $3,000 to $12,000 a month. And sometimes that's an a la carte menu. You might go into an institution and still need caregivers.
And that's true. You do. And I know that as someone gets older and declines and gets sicker too, they have to pull in additional home care and pay the room and board for the assisted living facility or the personal care home. So that's true. So we want to keep mom and dad or grandma and granddad home for as long as possible. I do have a question for you now that we're talking about that, though. Is there an accreditation association for home care agencies like CareMinders?
There is. I'm so glad you brought that up, Jeannie. There's an organization called the Joint Commission. Now, those in the medical community might remember them by their acronym that they used to be called by JACO. Joint Commission is a nonprofit third-party organization, been around since the early 1950s, not affiliated with any government agency, local, state, or federal. And they offer the highest level of accreditation for all of healthcare, not just home care. And the accreditation is 100% based on the quality of care that the patient or client is receiving. By the way, in home care, sometimes the individual is known as the client. Client-patient, synonymous terms. So they don't care if a hospital makes money. Joint Commission doesn't care if CareMinders Home Care makes money. They just care about the quality of care of the patient. And this
is the accreditation agency that many of the hospitals go through. This is very high-level accreditation.
It is the highest level of accreditation. In fact, we say here in healthcare that the Joint Commission accreditation is more important to our industry than anything J.D. Powers or Malcolm Baldrige could be for other industries. And it's just solely based. They peel away the onion. They drill down to the quality of care. If you're a hospital and you lose your accreditation, you have to start thinking about closing your doors. And I smile when if anybody knows a registered nurse who works at a hospital, and when they see the Joint Commission coming to do that survey, that can be days, weeks, and months, even though they're lovely people, but that nurse is about to go through some stressful days.
Those are long days and long nights.
They want to hide under the desk. They want to go home because even though they're wonderful people, the concern is the quality of care that the individual is receiving. It's
nice to know that there is an accreditation agency for private home care because I don't know that there has been for a while. Is this newer?
Well, actually, as I say, Joint Commission has been around since the early 1950s. Until 1988, Joint Commission did not have an accreditation program for the home care arena of healthcare. They did not realize that back in 1988, and as we approach our current time frame, that home care would be the fastest growing segment of healthcare. And back in 1988, coincidentally, right here in Atlanta, a woman pushed them and said, you need to come up with an incredible accreditation program for those home care agencies that would qualify for this accreditation. They agreed. They came up with this strong accreditation program. And this woman became the very first home care agency in the country, in the world, here in the Atlanta area, to be Joint Commission accredited. That woman is Elaine Jones, who's our COO of CareMinders Home Care.
And are a lot of home care agencies getting Joint Commission these days, or are you still not the norm?
It's not the norm. In fact, one reason we have joined forces with Joint Commission is that we want to elevate the standard of quality of care nationwide. And only 8%, Jeannie, only 8% of home care agencies around this country are Joint Commission accredited. And, so many folks that come to us that are interested in becoming a franchisee of ours.
I was going to ask that, because how do you keep consistent quality of care in a franchise? I love that you're Joint Commission accredited, because that forces you to be consistent.
Absolutely. And so many people that come to us because they've had an experience with a loved one, with themselves, and they realize that quality of care is not there. And so we wanted to elevate the standards of quality of care nationwide. We don't want to put other home care agencies out of business. We want everybody to follow us and have the greatest level of quality of care. And that's what our relationship with the Joint Commission is all about.
And that I like that, because they also require background checks and credentialing of all of your workers.
Absolutely. In fact, we have an industry exclusive standard with regards to background checks, and we don't, with the internet nowadays, background checks, things can slip through the cracks. And our industry exclusive background screening program for our franchisees doesn't just do local, state, and federal criminal background checks, Department of Motor Vehicles, sex offender lists, inappropriate behavior lists, Social Security lists. We want to make sure Debbie really is Debbie.
So you can you have peace of mind that if CareMinders is coming into your home with that Joint Commission accreditation, you're going to get great quality care, and you're going to get great quality workers that you can trust in your home.
Right, because the CareMinders system, we're the only franchisor system that has been approved by the Joint Commission. So our folks, our franchisees, become Joint Commission accredited before they even have their first patient.
Now, because we run out of time so quickly every time, tell me a little bit about your rates. Would all of this extra accreditation and going through Joint Commission and hiring maybe more qualified staff than other folks in order to meet the Joint Commission accreditation standards, does that affect your rates?
No. Our rates are very comparable on the non-medical side to other folks.
And what is the typical rate?
I would say here in the Atlanta area on non-medical, depending on the services rendered, it could be anywhere from maybe $18 to $25 an hour.
Okay.
Somewhere in that range there.
And that's for
companion and personal care.
And personal care.
Yeah,
okay.
Depending on what is the need and if a companion care caregiver or a certified nurse assistant. On the skilled care side, which, by the way, almost all skilled care is paid by somebody else in most cases, government agency and so forth. So skilled care costs will depend on the services needed.
Okay. And what's the typical amount of hours? And I know this is a loaded question for you, because what I want to leave the folks in our communities with is typically how much help do folks need, and typically how much is the average cost per week to get the home care to keep your loved one at home?
Well, on the non-medical side, we do have folks that need us 4 hours a day, 1 day a week. Some folks need us 4 to 12 hours a day, 1 to 7 days a week. And some folks need us 24/7 care. So there's a lot of folks that do have a caregiver all the time. Some folks say, I need somebody 5 to 6 hours a day.
Gary, this is great information. I'm sorry, I didn't mean to cut you off. Continue.
No, I'm just saying some folks just need 5 or 6 hours a day when their maybe a loved one is at work.
I myself had surgery recently, and I'm young. I like to think that I'm strong and healthy, but I really could use the help of home care, and I wish that I had thought about it, because because I tried to do too much on my own. I ended up putting myself back, got an infection, didn't take care of myself, and it ended up costing me in the long run because I had to take more time out of work. So you don't even have to be 65 to have home care. You don't need a hospitalization to have home care. If you need help to stay in the home and make yourself better, then contact folks like Gary at CareMinders. And that brings me to, how do people get in touch with you?
Well, our number, and we're located in the Alpharetta area, is 770-360-5554.
And you mentioned that this is a franchise system. Are you all over the United States? Are you regional?
No, we are all over the United States, and also we're having inquiries internationally.
So for our folks in Phoenix and New Orleans and Gulf South, you can also contact CareMinders to find out the nearest location to you. And is there an 800 number, or should they call the Georgia number? How do they
Just call the Georgia number, and
Okay.
they will get in contact with me.
And
or
shout that out
members
one
of our
more
team.
time for our folks.
It's 770-360-5554.
Thank you again, Gary, for coming and being with me today. We're going to take a short break, and when we come back, we're going to talk more about CareMinders, home care, how you can get the help you need in the home to keep your loved ones safe and healthy for as long as possible. Welcome back to Better Living. I'm Jeannie Pete, and we are here again with Gary Kinnlair, who is the president, co-founder, and chief franchise developer for CareMinders Home Care. We've been talking in the past half hour about CareMinders, what makes it different, how they're accredited, and really separate themselves from their competition in the Atlanta market and all over the United States. Again, for franchise information on where the nearest location is to you, you can contact CareMinders at, and the number is 770-360-5554. Gary, welcome back.
Thank you, Jeannie. It's a pleasure being with you.
I want to talk again a little bit about CareMinders. We kind of skimmed over it. How did you get into CareMinders?
I got into CareMinders after many, many years of analysis of this industry. I became aware of the need for home care through family members, and personally, I'm proud to say I'm a stage 3 cancer survivor. And
Are you really?
Yes, and far into remission, and I saw when I was in the chemo room what was going on firsthand, and I'm not over 65 years of age, and so I saw this need, and I saw the need for quality of care. I saw a very lacking quality of care out there, and I said, wait a second, there's got to be a better way to doing this.
So you're in, because now I want to know, so I want to make sure our listeners know, you're healthy and you're in remission and you're not having chemo anymore?
I'm healthy in remission and ran my first Peachtree Road race last July 4th. So, no, everything's great. I have as much a chance of getting cancer now as anybody who's never had it.
Well, congratulations.
Thank you.
Good for
Thank you.
You know, there's always a story that moves someone. You know, you hear of children who are sick and in the hospital, in and out of the hospital through childhood, and they grow up to become doctors.
Right.
And they are passionate. And when you're in the position to be the patient, you know firsthand how to deliver the care.
Exactly. You've been there and done it.
I love that. That's wonderful.
You've been there and done it. So we did not come to this from a corporate mentality, from a venture capitalist mentality. And we put it together a team here, along with my co-founder, Brian Schleicher. We put together a team that has 250 years of combined experience in home health care.
So let's talk about home health care, because I know there's some changes in legislation. How is that going to affect CareMinders and other agencies like you?
Well, we all have heard about healthcare reform. And, you know, it's a political issue, and we're not here to talk politics and how we're going to pay for it. But one thing that we do know about healthcare reform is more and more people are going to have healthcare benefits. And, you know, up until this point, we don't build hospitals every day, Jeannie. And the hospitals are being taxed. There's a limited number of beds. You know, a woman goes in and has a baby, or someone goes in for a heart procedure, and we're kicked out faster than you can shake a stick.
That was me.
Okay, absolutely. and there's two major reasons. One, limited bed space. Mr. Smith is waiting for your bed downstairs, as well as the insurance companies who are trying to keep their costs down. Well, with healthcare reform, there's going to be more people with benefits. These beds are going to be really become more scarce. And what a lot of people forget is just because they're being discharged doesn't mean that their non-medical and or skilled care needs are over. It's just being transferred somewhere else, and in most cases to the home, thus home care.
And, I was that woman who had the baby and really should not have been discharged. I was 6 hours in the recovery room, and I had to have all kinds of procedures after I had my baby. And they sent a nurse in the next day and said, would you like to go home early? We'll send a nurse to visit you in the home. I looked at her and I said, are you crazy? I can't even get out of bed yet.
Right.
And so I remember living that, and I should never have gone home when I went home. And I had a very difficult recovery. And so what I'm hearing you say is we're going to see more and more and more of that.
Well, not only that, but because of healthcare reform, Jeannie, the decision might not be yours. The institutions, the insurance companies and so forth, they're going to decide potentially whether Jeannie should go home after giving birth to your child. And so that's why in Care Minders, we don't just work with folks over the age of 65. We're ageless. We work with people from pediatrics to gerontology, from early birth to folks well over the age of 65. We have the Mommy Me program, where the mom comes home. And I have two children, 25 and a 20-year-old. And when I heard that we needed help when we came home and we had a normal delivery and so forth, why do we need help? Of course, I was a man. I had no idea.
I didn't say it. I'm not going to tell you what I was thinking, but I didn't say it.
I was just concerned about the neck. And I went, oh my goodness, when we got home, did we need help? Yes, we did.
Well, that's terrific. Okay, well, it's kind of scary.
It is.
So I do see, based on what you're saying and what I see out in the industry as well, being in the industry, that more and more folks are getting sent home from the hospital. And the hospitals are now being looked at for their readmissions for what the folks were in the hospital originally about. And they're not going to be getting paid for those readmissions in the future. And so they are even more determined to make sure that when they plan for a discharge for someone who's in the hospital, that they have a solid plan that will help them stay at home.
What a great subject matter you brought up, Jeannie. And a lot of people don't realize that part of what has been going on in Washington is this issue related to what you just said in hospitals. And it's coming down October of 2012, about 9 months from now. Up to this point, hospitals have been reimbursed by quantity of care. Now their reimbursement is going to be based on quality of care. And so if somebody's being discharged from the hospital and is readmitted to the hospital within 30 days or so related to issues of discharge, that hospital may not get that entire reimbursement that they were expecting to get. And
which is a good thing, because now it's in their best interest to make sure that they have the right plan for the people they are discharging.
Absolutely, because the continuum of care begins before you go to the hospital. You mentioned earlier, Jeannie, about preventive care. It starts before you get to the hospital. It's during the hospital stay. And what the heck happens to you when you go home? Yeah,
and I've worked in hospice for years and years and years. The audience knows that. We've talked about that several times in the past shows. But unless you're listening for the first time, and then stay with me. But it always frustrated me because I knew that folks needed more help, but they weren't being talked to about maybe home care or hospice, and they were ending up back in the hospital. And then by the time we were called to help, they had had an infection, they had had another procedure, they were much weaker. Whereas if we could have just rewound the clock and been told, hey, you know what, listen to hospice, don't be afraid of the word, these people can keep you stronger and healthier in your home with quality of life, just listen to what they have to say, don't fear the word. I'm hoping, because my heart is in hospice,
right.
I'm hoping. Actually, my heart is in keeping people at home. So whether that's home care, skilled home health, or hospice, it empowers people to be, like you said, where their TV is, where their birds are, where they're cooking the way that they like to cook. And it keeps them mentally more positive and physically stronger because they're around their families.
Life at home is the key to independence. Jeannie, one of the neatest things that touched our hearts, because what we're doing is a 2-for-1-er. for the community. We're not selling somebody another pair of shoes they don't need.
Right.
Our franchisees offer services, and it's helping the community. And are they receiving some nice compensation? Sure, absolutely. But when a franchisee of ours and has a patient that has passed on, and when CareMinders is mentioned in the obituary, is helping that family member in their last year or two of their life to elevate their standard of living, their quality of life.
You know you made an impact, a positive impact.
What more can you say?
And that feeds you to keep going. And as a cancer survivor, I mean, that's just got to feed your soul.
Oh, absolutely. I can hear about someone who has cancer in Seattle, Washington. I don't know that person, but they are a brother or a sister.
Yeah,
automatically. So same thing with other issues or ailments. So many people under 65 have cancer and heart and CP and multiple sclerosis.
Yeah, let's go there, because a couple more things I want to discuss. Folks, if you're listening, don't change the station, because I want to discuss the typical home care client or the different types of home care clients and the stories. Let's paint the picture for how you've helped folks with different diseases. And then I really want to get into, because there is some help out there for folks regarding payment for home care, and that is so important to talk about. So before we end the show today, we're also going to bring that in, like the Veterans Administration and long-term care insurance and other ways that you can get home care help. And I'm hoping that is increased as they push to keep people out of the hospitals as well. So let's start with what you just mentioned, the different diagnoses that you see. And there's no typical day, but right, on an average, and how your organization helps. Tell us those stories.
Well, with our franchisees, sometimes more than 50% of their folks are over the age of 65. And of course, folks, as you age, different things can happen, both non-medical and skilled.
And your children are moving away, and you need the help of people in your home.
Absolutely. And we're a very mobile society. It's not that, it's not the 1880s anymore. Mm-hmm. And mom and dad are both out there working and so forth. But unfortunately, so many people under 65 need our help. As I said, cancer and heart and multiple sclerosis, traumatic brain injury. People are hurt in automobile wrecks, dependent adult children who we thought were going to pass away, but they've been kept alive. Their parents are getting older. People hurt on the job. How about children's hospitals? Jeannie, I hope you've never had to go to a children's hospital, but there's too many departments there. Oncology.
I used to volunteer at the pediatric cancer ward. It's a tough
oncology
place.
And muscular and cardiology. And so on any given day, everybody in our community, from the day they're born to the day that you pass away, they might have the need, the necessity, the requirement, the desire to access the services.
And I know a friend of mine has a son who has cystic fibrosis.
Yes.
So there's lots of times where he has an episode and he has to come home with the help of home health. And they get so close to their provider. They really do. And then they request that person to come back. And they become like a family member.
Absolutely. It's a family member. And one of the most important responsibilities of our franchisees is to make sure that the caregiver, whether they're non-medical or skilled, is the right person, is the right fit for that client patient.
So how does that work? Do they interview a few folks, or do you send someone out and they say yes or no, and if they say no, you send someone else out? How does that work?
Well, it's our franchisees' responsibilities. Our franchisees all have their director of nursing, and that nurse will go out, registered nurse will go out to the client's home. They do a full assessment. Regardless of what the family thinks is needed, they will cover everything from A to Z. They will identify the needs, whether it's companion, personal, and or skilled care needs. And it could be a lot of things. Maybe the person is a smoker and non-smoker, and it's all the little things, animals. Make sure that they have the right caregiver that can match up not only skill set, but personality.
Well, and they might have, as you're talking, they might have different disciplines coming in on different days.
Absolutely.
Because you may need a nurse maybe once a week, but then you'll also need the personal care person to come in there and help with the meals and the bathing.
Right. You might have the nurse come in once, twice, 3 times a week for an hour or a visit, and some or all the rest of the time you have that companion or personal caregiver. You might have a nurse that is specializing in respiratory care, or you might have a nurse that is specializing in an IV treatment. it could be different folks coming
That's
in.
wonderful. And again, folks, you're listening to Better Living, and this is sponsored by Homestead Hospice and brought to you by the Homestead Hope Foundation. And you can reach Gary at CareMinders, if I can get the card here, put it too far away from me, at 770-360-5554. But remember, too, any guests we ever have on this show, every single week, you can access all of our guests through our website, which is www.homesteadhopefoundation.com. Or you can call us at 678-966-0077. And we are here in Georgia, but we do reach out. We have an office in Arizona, and we reach out and help provide resources. That's the whole mission of the Hope Foundation. So please come to our website, www.homesteadhopefoundation.com, and we can connect you to any guest that we have on our show. Just in case you forget the number to CareMinders. Mm-hmm. Sorry, Gary. I just want to make sure folks know how to access the resources that we're bringing to them, because you're saying you're giving it such important information. I want to make sure that we stop for a minute and make sure people have time to write
And
down.
I appreciate that, because Jeannie, one of the biggest concerns we have is that folks do not realize that we have these services out there. A lot of folks don't, they know there's an accountant out there, there's a lawyer out there, but they don't know that there's actually home care services to give them a break, to give them help.
And the other thing, when you've got home care coming, I am a proponent of home care, if you can tell, but when you've got home care in your home, you've got another set of eyes, another set of ears watching and monitoring, and they can get you the help of other agencies too. They can bring hospice in. They can say, look, you know what, I think it might be time to meet with hospice. Hospice would be in addition to CareMinders staff being in the home, but hospice is paid for by Medicare, so it's no additional cost. But you've got those eyes and ears watching and making sure that the other resources you need are brought in when they are necessary. And families don't know that. I didn't know that before I got into hospice. My grandmother was in and out of the hospital 5 times for CHF,
Right.
chronic heart failure. And gosh, I wish we had CareMinders in there, because they could have told us, she's going to end up in the hospital. Let's bring them in now. Meet with hospice. So there's just so many benefits from what I've lived in the healthcare industry and personally myself.
And that's why we require our franchisees to have a director of nursing, a registered nurse, because they are the eyes and ears. And it's not just a nurse who's maybe been on the 5th floor of a hospital. It's a nurse with home care experience, because it's a whole nother environment.
Right.
And so they're the eyes and ears for the physicians, for the family members. Because I can't tell you, Jeannie, how many times a daughter says, Mom needs this. And then when our nurse goes in there, they realize, well, you're right, but they also need this, and this may be happening.
And then maybe you can get a jump on changing in medications before crisis occurs, which keeps them at home as well and stronger.
Absolutely.
So all good stuff here. But we only have about 4 minutes left of the show. I do want to get to payment, because it's so important. People may not reach out for the services that they need because they're afraid of that. So let's help dispel those fears. Because I know that the VA has a wonderful program to help pay for home care if people qualify.
Oh, the VA, a lot of folks do not realize that many, many veterans and their spouses can qualify for as much as $1,800, $1,900, $2,000 a month for home care.
And that's significant.
That's a lot of money. And it's a process. You've got to wait through it. It's a government, quasi-government agency there. You're working through them. And it's a great benefit. One thing that we are thrilled about is that the folks in Washington recently have come up with this, what we call the Wounded Warrior Program. And you mentioned earlier in our discussions about getting people out of institutions. Well, we've lost a lot of folks in the wars that we've been fighting, but we've also have a lot of folks that have been hurt, men and women that have been hurt very, very severely, and they've been kept in institutions. Well, now the government is saying, we've got to get them out. We've got to get them out. They've been there 1, 2, 3 years, and we feel we are thrilled that we at CareMinders were awarded the opportunity to have the very first Wounded Warrior coming to the Atlanta area. A gentleman that took a sniper's bullet in Afghanistan, has very little mobility, 2 young children, a loving wife. The VA has worked on outfitting their home, and now we have set up his home in the Atlanta area.
Oh, that's
basically
wonderful.
as a nursing home. and he's back home.
Because you can continue rehab in the home.
Absolutely. If he has to go to the VA center, he is transported, but he's now home. He's now with his family. He's out of the institution. And we're thrilled to be working with the Veterans Administration.
Well, there's just so many benefits. I hope folks listening will reach out and get the information that you need. For veterans, you do have that VA program that does help pay for home care if you qualify based on your disease and based on your service time. And there's other things that go into that. How do they get information? Call their local VA chapter, or can they contact you and you can connect them to the right person?
We can. Our local franchisees, we have links and so forth that we can point them in the right direction as it is a process, or contact the Veterans Administration.
And again, you know what? Just contact the Hope Foundation, because we've had an elder care attorney on in the past who specializes in that, and she's all over the country speaking, so we can connect you no matter what market you're in. And we've also had someone who works for the VA on our show as well. So again, remember, any past guests and any topics we've ever talked about before, the Hope Foundation's mission is to connect seniors and their families to resources, connect everybody to resources that can benefit them from a one-stop shop. So go to www.homesteadhopefoundation.com and get connected today if you need some help. Thank you so much, Gary, for coming.
Oh, Jeannie, it's been an absolute pleasure.
Important information here. Okay, folks, well, I hope you all have a great week. And come back and see us next week. Come back and listen to us next week. I'm Jeannie Pete, and this has been Better Living.